All right, so basically this patient has an ingrown toenail only on both sides of the toe. Beautiful flat nail otherwise. So that's why we're going to actually take only the sides of it for good. And then we're going to use a technique called the phenol and alcohol technique. It's a little different than the vinaigrette technique, which we would usually do as well. So here we go. All right, I need, excuse me. So every time I move away, you want to stop it. So what we're going to do is we're going to clear up the part of the nail back here. We don't want to take too much. We just want to take away the side of it. As you can see here, not much going on. We're just going to remove the side, and you can use whatever you want. I use a small little. Do you feel this?
Not a little bit.
Okay, how about this one?
Not as much.
Okay, good. Then we're going to remove only the side of it. And I usually take out a little bit at a time. I don't take out too much. And I only go to the edge of the nail there. And why I do this is because then I proceed with my 64 after that. So let me have the 64 next. Okay, 64 blade, and then I go down and I cut through this all the way through, and then the same here. Cut down all the way through. Once we have that, and then we're going to remove the sides for good. So we're going to come inside here, remove the sides of the nail out. As you can see, this hand here, put it right there.
Thank you.
Bless you.
Thank you.
Okay, so that's one side, one border. And this is the other border. Okay, so there's the other border. Yep, go ahead. And if you would take a picture of that, I'd appreciate it. All right, so now we're ready for the phenol. So what you do is with the phenol, you get, I'm gonna put this here because we don't need it right now. You open it up. Okay, it's very caustic stuff. What we do is we get the phenol and we put it inside the area where we need to go. And for 30 seconds, that's my technique. Usually some people go 20, some people go less, depends. I like 30. And my nurse is usually monitoring that on her watch, digital watch.
You had about 15 more, or 10 more seconds, sorry.
All right, 10 more seconds, that's good. So do you have two ready?
Yep.
Okay.
And you're good.
And we're good. So that's the first one. Now the second two. No. 20 seconds this time.
Okay.
And again, that's my technique. Some people do different numbers on the minutes or seconds. Is it done?
You got about 1 second.
There you
20,
go.
there you
1
go.
second. All right, next one is 15. And there you go. This technique usually kills those cells 80% of the time. 20% of the time you will have a cell that, you know, survives this
That's
chemical.
15.
Thank you. Give me another 2 sets. And those are 10s. And the next 2 sets I want you to put in alcohol. So the same technique you did with the phenol, you do alcohol. The alcohol is right there in front of you. I pulled it up.
There's 10.
Okay, thank you. Actually like to put a lot of alcohol in here. So, and what the alcohol is doing, it's basically stopping the action of the phenol. So it binds to the phenol and stops its action. This way the tissue does not continue to be burned up. Phenol is a base. It's an organic base. So it's doing the same thing like an acid, but on the other side of the pH spectrum. If you know what I'm talking about. But that's it. Once we're done, we put Neosporin and we're out.